Well, we have taken very detailed contingency plans and put them in place for this morning, and we are hoping that they will do what we need to do to make sure we can maintain the basic emergency services. But obviously it's much harder to give that guarantee when you're using Army personnel who won't be experienced in NHS matters, but we've done everything we can to prepare for this morning. Well, let me start by saying that I agree with you. They are working very hard. There is a lot of pressure on the NHS front line, and I think we all need to acknowledge just how tough it is out there in A&E departments, in hospitals, in GP surgeries, in the ambulance service and so on. We are giving a 1% pay rise to everyone, but around 55% of NHS staff get an automatic 3% pay rise through their increments. And what we're saying is we can't afford to give a 1% pay rise on top of the 3%. And that's for a very simple reason. We have very clear analysis that says that if we did that, hospitals next year would lay off around 4,000 nurses and around 10,000 nurses the year after that. And that would be very dangerous for patients. And so, very reluctantly, because we would like to be more generous, but it's just very difficult at the moment, we concluded that the responsible thing to do was to give 1% to everyone, but not to people who are already getting that through their increments. Well, we're always open to discussion, but what I've made very clear to the unions is that any discussion has to be within the bounds of what is going to be right for patients, and we have to make sure that we end up with a decision that isn't going to lead to nurses and frontline staff being laid off. And within the bounds of that, then we're always happy to discuss any of the details about the pay rise, about the increments, and about general pay and conditions.